17 people tested positive for COVID-19. And now 6 children have been added to our numbers. We have not seen a surge this large since we confirmed 12 new positive cases. And based on the trajectory, we can expect to see these numbers to continue. We are just approaching what is expected to be the exponential phase of the curve. But this curve is simply that, an expectation. It does not have to be our reality. As of today, 23 people have recovered from COVID-19 on Guam, and we know this number will grow every day. For some, recovery was slow and grueling. For others, they experienced no symptoms at all. Our recoveries vary in gender and age. Some have travel history, others do not. They come from all corners of the island. However, they all have something in common. They show us that we can beat COVID-19, that there is light at the end of this tunnel. I know this is an incredibly challenging time for our island. This pandemic has brought grief to some, financial hardship to many, and enormous disruptions to us all. We live in uncertain times, but nothing is more certain than the resilience and strength of Guam's people. For nearly 4,000 years, our people greeted the morning sun after every passing storm. We rose up, we rebuilt, and we make Guam a little stronger with every new generation. We face a common difficulty that risks our lives and our life's work, but we are using every tool we have to bring help to Guam now. I've also asked the legislature to grant me clear executive authority to enforce rules which will implement social distancing, stop the spread, and expedite our return to normalcy. Our enemy is vast, it is silent, it is deadly, and hidden, but our people are strong. We will bear any burden, make any sacrifice, and suffer that we must today, so that our children can have tomorrow. No governor in this country knows how long this crisis will last, but I know that Guam has outlasted every crisis for thousands of years. That is just who we are, and that won't change because of COVID-19. I will end with my deepest appreciation and gratitude to the women and men leading this fight. To the nurses, doctors, care workers, first responders, and public safety officers who are putting everything on the line every hour of the day to save our parents, our grandparents, friends, colleagues, neighbors, and strangers. At the onset of this pandemic, one of the first things I did was make housing arrangements for them so that they would not have to make the painful decision between their families and their duties. This was on a voluntary basis, and some decided to utilize these facilities while others have not. While this arrangement was not made public, rest assured that we have the best interests of our healthcare workers in mind. Today's COVID hero is the University of Guam. UOG is making more than 200 meal deliveries per day to healthcare workers and volunteers at public health sites. This effort initially started with helping the nurses manning the medical triage hotline, but they have expanded to helping our public health teams at the port, airport, and the health centers. UOG is also hosting a telethon this Wednesday to raise funds for emergency medical personnel assisting with COVID-19 crisis. Thank you, UOG, for your help and being COVID hero. I'd like to ask Linda, now the Director of Public Health, to provide us for updates on the COVID.
Thank you, Governor. The testing as of from the beginning of this epidemic, March 12th, 2020, all the way to April 5th, 2020, we had a total of 595 tests that were run. Of that amount, 485 are negative, 110 are positive. And of the 110 that are positive, 101 are local and 9 are the testing that was performed by the U.S. Naval Hospital. And that is done again in San Diego. In addition to this 110 COVID positive patients that are laboratory tested, we also have 2 clinically diagnosed local cases. Thus, we have a grand total of 112 COVID cases as of today. In regards to the demographic breakdown, the region at the northern, we have 54 COVID patients residing there. At central region of the island, 38 patients. From the southern region, 17 patients. The homeless, there are 2, and 1 is pending determination. Thus, that's 112. As the governor alluded earlier, we do now have cases of children. From the age bracket of 0 to 9, we have 1. From the age group of 10 to 19, we have 5. From the age groups of 20 to 29 years old, 11. 30 to 39 years old, 11. 40 to 49 years, 20. 50 to 59 years, 19. 60 to 69 years, 31. 70 to 79 years of age, 9. 80 to 89 years of age, 4. And 90 and above, 1. That totals 112. In regards to the gender, there are 55 males and 57 females. The medical status of these individuals, we have 65 that are stable. However, 18 are hospitalized. And the breakdown for those 18 individuals, we have 9 in the inpatient care at Guam Memorial Hospital, 1 at the ICU, and 8 at the skilled nursing facility. 25, I'm happy to report, have fully recovered. That's 2 more people just recovered as of today. 4 deaths and a grand total, of course, of 112. Those are in home isolation right now, we have 49. Those that are in the government of Guam isolation facility, 16. Those at the SNU, 8. 9 again inpatient care, 1 ICU, 25 recovered, and 4 that are dead. In regards to the travel history, 1 came from Japan, 11 from the Philippines, 1 from Singapore, 2 from Dubai, 5 from the US mainland, including Hawaii, and 92 had no travel history. And those cases of 92 without travel history are as follows. 24 are household contacts. 11 are community contacts. 13 are healthcare contacts. And of that 13, 5 are contacted as a patient and 8 as a healthcare worker. And 44 reported no contact. Currently, we have in our quarantine sites a grand total of 116 individuals that are there today. And as I mentioned earlier, they will remain there for 14 days. In regards to those that have cleared the quarantine facility as of April 6th, we have a total of 24. So the grand total of those travelers that finished the whole 14-day quarantine from April 2nd all the way to April 6th is a grand total of 223 individuals. And of those that recovered fully, 25, as I mentioned earlier, the age breakdown are as follows. There are none from 0 to 19, 20 to 29 years of age, 2, 30 to 39 years of age, 4, 40 to 49 years of age, 5, 50 to 59 years of age, 5, 60 to 69 years of age, 6, 70 to 79 years, 1, 80 to 89 years of age, 1, and 90 and above, 1. In regards to the sex of those that fully recovered, 14 are female, 11 are male. The region of where they reside, 5 reside in the northern region of Guam, 12 at the central region, and 8 at the southern. There are no homeless at this one. In regards to the travel history, 7 have traveled 14 days before their onset. 14 have no recent travel history at all, and 4 are undetermined. And again, we would like to emphasize that the numbers to call are still very valid. And if I may, I'd like to inform the public, please contact these numbers if you have any medical conditions that you would like a nurse to triage. And those numbers are 480-7859, 480-6760, 480-6763, 480-7883. If you have any psychosocial or you need to speak with a social worker, please contact any of these numbers, 988-5375, 683-8802, 686-6032. Thank you.
I have a question to Member Juanita. There'll be one round of questions. That's one question and plus one follow-up. First up is Steve Santiago from the Pacific Daily News.
Yes, hi, Governor.
Hi, Steve.
I just wanted to follow up on something you said last week about Guam receiving 30 ventilators through a partnership with the military. Could you elaborate on that? So why are we getting that, and what else are we getting because of that?
Okay, so FEMA, of course, any medical supplies or any equipment that we need, we have routed it up to FEMA. And FEMA has routed it to our regional administrator, which is John, I forget his last name, I think Tartley. But anyway, we got an email from him saying that we will be receiving 30 ventilators. And one of the requests, of course, is the request for more ventilators, request for more PPEs, request for more tests, request for more surgical masks, gloves, and so forth. And we were informed by email that there were 30 ventilators that were on their way, in addition to some more testing kits. And when my chief of staff was talking to John, he had specifically mentioned to John that the 30 ventilators actually came from the White House. The ventilators are needed in anticipation of the surge and in anticipation of increased hospitalization and in anticipation of increased demand for ventilators to treat respiratory distress as a result of COVID-19.
As a follow-up to that, my understanding is Guam currently has 15 staffed ICU beds. So how could you use the additional ventilators? How would they be used? Would you have to create more ICU beds, or how does that work?
Exactly. Yes, we are planning. I don't know if you were there when Dr. Luis Cruz was giving some information on what kind of facilities we are looking at, what kind of alternative care facilities we're looking at to be able to house and to be able to provide more intensive care treatment and more acute care treatment. So it would definitely be, what do you call that, an expanded capacity to be able to treat the anticipated volume of those individuals that require acute and critical care.
Thank you, Steve. Next we have Nestor Santos, Lou Leon.
Yes, thank you. Good afternoon, Governor.
Good afternoon, Nestor.
Obviously, the report of the 6 kids being infected is very troubling. How, when, where did that happen?
Yeah, I'll have Linda come up to speak to you, but I just wanted to agree with you very emphatically that it is troubling, and it's just a demonstration again that the COVID virus does not discriminate against age, sex, ethnicity. It is through all socioeconomic statuses. It's a virus, and it doesn't. It's not selective. And so that's why, again, we continue to plead for our community to be very serious about it. As like I said, we're starting to see children being infected. But Linda can tell you more about how these children are related, if any.
Thank you, Governor. Yes, in regards to the first age group that I mentioned, the 0 to 19, of course, that was a 1-year-old individual. It's a baby, of course, and it was due to a household contact. In regards to the 10 to the 19-year-old age range, there were 5. And of the 5, 3 are household contacts. 1 was travel related from Honolulu, and the other one was a social event where they got the infection.
Okay, so it wasn't at school. Okay. Second question was
No.
obviously the spike yesterday of 17, the highest by far of so far.
Yes.
Where are we in terms of peaking?
Speaking?
So, if my memory serves me right, according to Dr. Felix Cabrera's numbers, where he did the trajectory, and he looked at if we were only impacting spread by 33%, and if we decrease that by 20% more, 40% more, 50% more, but if we were just going to look at the 33%, I think he was saying we would peak in June with a hospital census of about 6,000.
Thank you, Mr. Good point. Oh, yeah.
Buenas, Governor. How are you? I hope you're doing well. I know it's
Thank you, Oya.
been a hard task doing this, and I know a lot of people appreciate your efforts. I did want to ask, there was an explanation a few days ago where regarding decreased testing, and what we were told was that there were quality control issues. Is there an issue at the lab, or was it a number of test kits that were available? Can you expound on that?
I think probably Linda would be more appropriate for that.
Okay, oh yeah, your question was as far as the test kits?
Testing.
Well,
Testing.
the testing a few days ago decreased to I believe you were doing less than 20 tests for a few days, and we were told
Yeah.
that there were quality control issues.
Right.
Was there an issue with the lab, or was it some other issue with the number of test kits available?
No, it was the laboratory. There's a quality control that we have to make certain that we get rectified. And so that was just because some of the tests are inconclusive, and it could be, there are various factors that could come into play. For example, the way the nasopharyngeal swab is taken, sometimes it's not done right, or it could be where the test result doesn't say it's a positive or a negative. So that's what we call inconclusive. And again, that has a lot to also do with the medium that is part of the testing. And so the quality control is a mechanism where the lab has to go through to make certain that the test does come out correctly, whether it's a true positive or a true negative. Or if it doesn't have any of these, then they have to go back and redo the testing. And so that is what we call the quality control measures that have to be in place so that we can get a test that is accurate. Does that
so
answer your question?
Okay. Yes, so the lab is okay, yeah?
Yes, the lab is fine right now, yes.
Okay,
And go ahead.
Sorry, the next question is with respect to a recent investigation that you guys have started. Is there a reason to believe that there's a cluster with respect to the Iglesia Ni Cristo Church? And
Yes.
Yes,
I mentioned that yesterday. Yes, there are several places that we've identified, and we're going to be putting that announcement very shortly. And yes, it's the Iglesia Ni Cristo, all the different areas in the various villages have been identified to be all linked to patients that are COVID positive from that event. That is correct.
Thank you, Oya.
And as far as our testing, as the governor mentioned earlier, she's gotten 30 ventilators, excuse me. And we also were notified by HHS, Health and Human Services, that we're getting 460 boxes, which is about 10 per box, which translates to 4,600 additional test kits, but with a different type of machine. It's called a Gene Expert machine, which is also done through nasopharyngeal swabs. And we're also going to get 4,600 more nasopharyngeal swabs in addition to one kit that will be like the quality control kit. And that is, again, coming through a grant from the Department of the Interior. And so that's another mechanism. We also are going to get an Abbott ID Now kit it's actually a machine along with the test kits, and that's, again, done through the federal government. And so these are things that we're getting additional support for. The Abbott is a rapid kit, so that testing can be done in 13 minutes. And again, it's a nasopharyngeal swab. It's a point of care type of testing that we're also going to be receiving through the help of HHS, Health and Human Services. So hopefully they all arrive. And again, we also have DLS, and I just got a call from DLS, Cynthia Henson, and she is also doing tests for us, sending it also off island. For those that are not in the high priority, those are the low priority. Again, we're making that available for our Medicaid, MIP, and our uninsured patients.
Thank you, Aya. Pacific Island Times, Johanna Selena.
Half a day, Governor.
Have a day, Johanna.
So yes, my question is related to the schools because I understand that there's an announcement that it's now shut down today from GDOE. So my question is, will teachers be mandated to create online work or packets for students?
I know that my last discussion with the superintendent, which was about maybe a week ago, and we were discussing the possibilities of the schools being closed for the rest of the school year. He did say that he was working with the teachers to create some kind of online education and some kind of modification maybe in the curriculum, and also some credits that could be valid. So I don't have the details about that. You might want to just call him up and ask him.
Okay. So my next question is regarding extra power bills. So is the legislature and executive branch, for that matter, allowed by any law to enact bills without holding a public hearing?
You know, I'm not sure. I'm not sure. I think they still have to hold public hearings. And then it's a matter of, well, how do you hold a public hearing that doesn't create a social contact situation, whether they can do it through maybe Zoom or electronic means. You would have to ask the speaker. The executive branch is not the branch that would be working on that.
Chris Barnett, you're next, but I can't unmute you. I'll return to you at the end. We're going to fix that. Mariana's Business Journal, Maureen.
Buenas, Governor.
Hi, Maureen.
So I wanted to ask if you have heard from the commander of the 7th Fleet, and if you have also been updated on any Navy numbers and how the sailors are doing in our hotels.
Right. So the commander of the 7th Fleet, Admiral Mertz, was here. I met with him this morning, and he just came. He's here, I think, to look over the operations of the vessels and the system that's been put in place to deal with the sailors. As far as I am aware, Admiral Manoni has reported to me that things are going okay with the sailors at the hotels. They are complying with the conditions and the controls that we have put into place. I also do know that all of the sailors that are positive do not need hospitalization, and their symptoms range from mild to moderate.
Okay, thank you, Governor. And my second question is whether you've been informed about the suggestions by the congressman this morning to the 3 of the legislators concerning GIDA and the retirement fund, or a similar solution using the island's banks, and what are your comments?
You know, I have not been informed. The congressman has not spoken to me directly about his proposal. I did not follow him on the public social media. So I don't know. I don't know what his proposal is.
But would you be agreeable to the war, just to clarify, would you be agreeable to the war claims funding being used as a guarantee in any form for payments that would be handled through GIDA and the retirement fund as direct deposits to the people of Guam?
So with the war claims funding, I do know that we have about 80 that we have processed here locally through our local program that is pending the payments, and we will pay for all of that. Right now, we have not yet received any kind of reimbursement for the advancement of the money that we have set forward. There is still a war claims fund that continues to be under the control of the U.S. Treasury, and with the 1365 passage, they can now release those monies. So those monies have already an assigned claim. So I don't think that those monies will be available because those are already earmarked for the individual war survivor. We have not had any returns of the war claims. I am looking at a program that is very possible that we would be able to provide for our local community. And once I get all the details and so forth, I will certainly make the announcement.
Thank you, Maureen. Chris Barnett.
Have a day, Governor.
Have a day, Chris.
I just wanted to ask if there's been any update from the speaker on emergency session.
No, I don't have any update from her.
And then I guess since that was such a short answer, could you maybe tell the people of Guam, I know that you're trying to get extra measures passed in legislation, but do you want to like kind of make a plea to the people of Guam, you know, to do the things that you're trying to get the legislature to do, and maybe just kind of calling them again to honor these orders that you want to get put in place?
Absolutely. Every opportunity that I can, I will. The directives and the mandates that I have put forward have been done for the protection and the safety of the community. It's done for measures that would decrease COVID contamination and COVID transmission. We have been very aggressive in these measures. We have been very proactive in these measures. We've been actually very even early in implementing these measures. So I ask the people of Guam again to please abide and comply with these measures. It is very crucial that we do this as we are starting to see more increases in our cases. And the only way that we can decrease these cases, the only way that we can eradicate these cases is through social distancing, through staying home, through decreasing social contact, and so forth. And so if you follow the measures that I have put forth, it's basically geared towards that. We've closed businesses, we have closed restaurants, bars, any kind of public centers we have closed. We even didn't allow the marathon. We did not allow basketball tournaments here, all because I wanted to make sure that we minimize our social contact. So I am pleading and I am asking our people to please, please be committed to saving the lives of our people. And I have said that I'd like for you to take a picture of your Nana and put your Nana's picture on the dashboard. And when you decide to get on the car to go to a place that's not essential, you're going to say, no, I'm going to stay home because I love my Nana.
Thank you, Chris. John Connor, Coastline.
Hello, Governor.
Hi, John.
This is to follow up on the Iglesia Ni Cristo issue. So how many people have tested positive from the church? How many PUIs are there as a result of that? And what is the extent of contact tracing? Is it possible that individuals from Saipan have been in contact and tested positive due to contact with people who are members from the church from Guam?
I'll have Linda respond to that question.
Thank you.
Yes, there has been contacts, and yes, there are 2 positive cases that came from CNMI that have been involved with this church, and that is correct. And I will be issuing this week that information, and we'll get it out to the public to be more specific. Okay?
You can't provide the number of PUIs at this time?
No, not right now. We're still investigating this, as you know, because we're just trying to connect all the different types of linkages, whether they're household or whether they're close contacts. And when I say close contacts, that will also be inclusive of people that they know, their family, and also if they're congregating as in social events. And so that's what we're putting all together.
So when did you first hear about this issue?
Again, when we had the positive case from the CNMI, that's when we found out about it. And then we're starting to, the investigation that's ongoing that we put together as we get more cases that are very similar, and we link them to find out who's the index, and then from the index, all the contacts. And that was sometime in the latter part of March when we found out.
Thank you, John. Pacific News Center, Kevin Kerrigan.
Yes, good afternoon, Governor.
Good afternoon, Kevin.
The Speaker's office, as you know, released draft legislation yesterday proposing a $5,000 fine and a prison term for those who violate your executive orders. Some have suggested that's too harsh. Is that a measure that you support and asked for?
I asked for legislation that would allow me to be able to enforce my directives, and I've asked for fines and civil penalties. I do think 5,000 is a bit high. Some places have started off with 250. They couldn't, people were not complying. They went up to 500. People were not complying. So, but I do think 5,000 might be too steep. And, you know, I don't know whether the legislation says up to 5,000 or the legislation says 5,000 immediately. I haven't really seen the draft legislation.
And are there any other measures that you have asked the Speaker to introduce to enhance your enforcement powers? If so, what are they?
Yes, one of them was the curfew situation, where if we could be, if there's statute that would allow, you know, the curfew to be also extended to everyone and not just minors. That would, I think, be also very appropriate. I just wanted to say also, Kevin, in terms of the fines, I did not suggest any amount to the senators. I did ask for legislation, but I did not make any suggestions in any amount.
And now for closing remarks from the governor.
Thank you again very much for this opportunity to again speak to you and again to make my plea. I know it may sound repetitive and it may sound like it's just every day the same, but I think repetition works, because I've seen where repetition would then be impressed in the mind and then action will be taken. I'm very worried, very concerned about these numbers on the rise. I'm going to work very hard, and I'm going to do everything I can possibly do to turn these increase around. And I'll be always there to do that. But I also need your help and your support and your commitment. I can't do this by myself. I am asking the people of Guam to come together and help us win this battle. Thank you, and to Zeus Masi.